Dear ladies and gentlemen, good afternoon, good evening, and good morning, depending on the time zone you are living in. I'm Dominik Plattner, the ITTF High Performance Manager, and I'm very delighted to warmly welcome all of you to our 49 ITTF High Performance and Development webinar with the topic Physiotherapy Support in Table Tennis. This time from nice Slovenia, from the WTT Youth Star Contender in Otočec, following our high performance under 15 and under 19 girls training camp of last week. And today we will hear that the physiotherapists have more tasks than just doing the massage and helping during the rehab phase. For example, the prevention gets very much neglected. And we are very much looking forward to hearing more details about their tasks. But before going over to the introduction of our guest, I want to talk briefly about our webinar code of the Q&A. To all the attendees, please leave your questions in the Q&A section, and our guest will try to answer as many as possible in the question and answer part of the webinar. Thank you very much for taking care of this. And now over to the introduction of our guest for today. It's a great pleasure and honor for us to warmly welcome an expert in health sciences. So Dr. Abdallah Recep, PhD from Tunisia. He's a specialist in physiotherapy, the Doctor of Health Sciences. He graduated from the University of Ghent in Belgium. He has an extensive experience in tertiary hospitals, orthopedics, and sport physiotherapy. Currently affiliated with the Aspetar Hospital in Doha in Qatar. And he is a long-serving staff member of the Aspire Academy in Doha in Qatar, dealing with the adolescent athletes in different sports. And his research interest is in adolescent athletes, epidemiology, and risk factors. So thank you very much, Abdallah, for taking the time. It's nice to meet you.
Thank you very much. I'm happy to be with you.
Thanks. And also a warm welcome to our experienced ITTF High Performance Elite Coach Massimo Constantini in the next room to me. So welcome. And, I would like to pass the word to you, Massimo.
Thank you, Dominic, and thank you very much, Dr. Abdallah Recep, for being with us. Yes, we are in Slovenia for this commitment during the Youth Star Contenders, WTT Youth Star Contenders, and then we have today this privilege to hear about physiotherapy support in table tennis. Our journey around table tennis continues from any angle, and today we will hear something really interesting in supporting our players in the performance, in the rehab, and so on. So without further ado, I will pass the screen, the computer, the laptop to Dr. Abdallah Recep for his presentation, and enjoy the presentation. Thank you.
Thanks to all. So thank you very much, everyone, for having me. And special thanks to Dominic and Mr. Massimo for the nice words and your kind introduction. And thanks for everyone for this kind opportunity. Today is my big pleasure to present in front of you the table tennis and the physiotherapy support. And this is an important platform to give you an information what physiotherapists could help with the other sport scientists around the table tennis and other sports. So let me start with a question. Do young players have access to support from scientists? An example of physiotherapy, and if so, what will be the difference that makes for their performance? But let me also start with a story. It is an unfortunate story, but it has a lot of meanings. I will tell you about one player. His name is JS. At the age of 16 years old, he was an elite target athlete from a Middle Eastern sports academy. This guy, he used to travel a lot with his coach, But unfortunately, this one of the times he traveled without any medical support, neither physiotherapy also. And he has a history of upper respiratory tract infection with fever. And from the anamnesis we have done to the athlete, that he was training and even taking part in some competitions with fever. 10 days later, when he came back from a tour and competition in a nearby country, he was complaining from an awkward, uncontrolled mobility of his dominant side shoulder. He was escorted by his coach. As he was a very good athlete and target athlete, his coach was very stressed. So we have taken the opportunity to treat him, to rehabilitate him, but in vain. There is no good result. We took him to the even outside neurologist and good neurologist, and it was unfortunately diagnosed with a subscapularis nerve degeneration. For people, this nerve injury is a difficult one. It happens at the level of the shoulder, and because it happened to a table tennis player, it has a disastrous end, and the player and his career. Then we can discuss about the lessons learned from such thing. It seems that it is a viral infection, which is common, and because it happens to a dominant side shoulder for an athlete player, then it was a disastrous end career. Now, I will start my introduction talking about table tennis. Of course, it is difficult to talk about table tennis among the family of table tennis. So, as you know, table tennis is an individual pair sport which makes it to the top most popular sports list with over 900 million players according to some statistics. However, despite table tennis is very popular, not much is known about its characteristics and required competencies, and a lot of work, a lot of things, a lot of parts of table tennis and the science surrounding table tennis still untapped. Historically, we used to know that table tennis is led by a coach. It is a coach-driven philosophy. The coach himself will diffuse skills and competencies to his athlete. But later on, and mainly the last decade, there's a proliferation of sports science, and it become a little bit for table tennis, but not only for table tennis, for all sports, it became a little bit sports science driven philosophy. So what are the sports science that are surrounding table tennis? We have SNC. It has a fantastic input or adds on for table tennis. It increases the performance, the fitness of the players. Biomechanics, there is a lot of works going on and starting to be published for improving also the performance and the accuracy and time reaction for the players. Physiology, it has a lot of input in the monitoring of the athlete load. We have also the input from the psychology part and the teaching, the improvement of the resilience of the player. We have the nutrition, which became a cornerstone for every sport and even for table tennis. And we have also performance analysis to see the baseline information about players of table tennis. We should not forget sports medicine and physiotherapy and talent identification that are resourcing from the grassroots. What are the players that may help and they have very good talents to become table tennis players. In our presentation today, our focus will be on the physiotherapy input in table tennis. It is really very unfair that our role as physiotherapists will be limited or reduced to injury management. Yes, it is a main part, but it is not the only one. We are doing at the start of every season athlete screening and profiling. It is very important because we know exactly, I will explain later on in the next slide, what we are doing in the screening and profiling. We are with other staff members surrounding the table tennis team. We are working also on the training load monitoring, which is now a trend in all sports and mainly in table tennis. We are supporting the team during tour and competition, and our role is very important. And we are doing our strategy for recovery and wellness, that well needed for the players. Of course, we should not forget our input and our main role dealing with the grassroots players and the adolescent athlete, and they are very, very specific to deal with matter of sports science and medicine. So broadly speaking, our role is divided in two main roles. The first one, what the most people know, is the injury management, and the second one is the injury prevention. Now, starting with the injury management, the strongly held belief that because table tennis is a racket sport, that the most injury they come to the upper limbs. Scientifically, it was proven the opposite, that the lower limbs at the back, they predominate and they prevail in the injury recording and injury occurrence and incidence. So starting with the upper limbs, we have the anatomical side of the shoulder, as you may expect. We have also the elbow, and we have the wrist and the hand. Of course, we have some other type of injuries, what we call non-structural, they are more functional injuries, and we call them the DOMS, delayed onset of muscle soreness. Now, going to the lower limbs and back, the elective sites of anatomical sites of the injuries, they are the ankle, they are the knee, groin and pelvis, and they are the low back. Now, if I want to focus on the injury management of the upper limbs, what are the main diagnoses for the shoulder, for example? We have the impingement and the bursitis, and we have the rotator cuff injuries. The rotator cuff, for people who don't know, they are formed by four muscles: the supraspinatus, infraspinatus, teres minor, and subscapularis. And we have a big title or a big chapter of the scapular dyskinesia due to slouching position of the table tennis player sometimes, and there is particular behavior and particular management of this type of injury. Talking about the elbow, we have the tennis elbow, and we have also the golf elbow. We have the little league elbow, where there is inflammation in the adolescent age, and we have also another one more serious, which is cartilage injury, what we call OCD, or osteochondral defect. Talking about the wrist and hand, we have also the fibrocartilage complex in the wrist and the medial side, and we have some tenosynovitis, we have some inflammation of the feet of the tendons in the hand and in the fingers. Now, for the lower limbs, we have the lower back, and the injuries of the lower back, they are mainly what we call unspecified low back pain, or we call also facet syndrome, and it came mainly when there is abrupt back extension, and we have the fearful injury of spondylolisthesis. We have seen this in some table tennis athletes, which is a stress fracture happening at the lower back at the level of L4 to L5 or L5 to L7. That means the least vertebrae of the low back pain. We have other orthopedic conditions and issues as scoliotic deviation or kyphotic deviation or slouch attitude for certain athletes. Now, talking about groin and pelvis, we have, as for other sports also, the long-standing groin pain, which is coming more of abrupt or awkward lunging, and we have the irritable hip. We have a newly diagnosed diagnosis in the hip, what we call CAM or pincer syndrome. It occurs mainly for the athletes who started very early their training, early specialization, and we have osteochondrosis, which are all the injuries that occur to the adolescent age. We will have the chance to see this in the next slides for the adolescent age. Talking about the knee, we have some meniscal injuries, very rare ligament injuries, as you can expect, but we have some synovites surrounding the knee, either what we call suprapouch, suprapatellar pouch, or the Hoffa syndrome, which are the synovitis that occur around the knee. Now, talking about the foot and ankle, we have ankle sprain, as you may imagine, just an awkward landing. It can twist the ankle, and we have some other things when the biomechanical of the lower limbs, it is either in valgus or varus that can produce specific type of injuries. Also at the level of the foot, when we have a high arch, stiff high arch or flat-footed, then there is a very need to refer these kind of athletes to the podiatrist to make a confection of foot insole that can alleviate this kind of symptoms and even help to the performance and less complaining. Now, we talk about the second big chapter that we are doing. We are talking about injury prevention. As all of you know, that injury prevention is better than cure. If we prevent an injury, is even better than curing the injury. And the first chapter of this injury prevention is the athlete screening and the profiling. To see here for this template, the first one we have to talk about the injury, previous injury. As you know, it was reported in the medical literature that the best predictor of a new injury is a record of a previous injury. So we have to see what are the previous injury for previous season in that particular athlete. Then we have to see musculoskeletal screening. We have to see the attitude of the athlete, slouch attitude, for example. We have to see if there is any knee valgus or deformity. We have to see if there is any lower limbs discrepancy. This is very important to record. Then we have to have a grasp of the flexibility status of the athlete by looking at the posterior shin, inferior shin, and we have to see exactly what is the problem, for example, medial rotation, lateral rotation for the shoulder. Having all this information together, we have to lay down this athlete have some hot spots there, and we are expecting that he may have some injuries in this part. Then at the team level, we have to take all this report and discuss this report with other stakeholders, and mainly the coach or the coordinator of the service team around the athlete. Then we have to lay down a prevention plan during the year according to the availability of the athlete. The second also big element in the injury prevention is now training load monitoring. We are an active part with other member of the service team of the table tennis to record and to collect the information related to the quantity and the quality of the session, training session, and we have to follow up these wearables, take the data, and we will have to find what is the acute chronic load ratio, and we have to make sure that this ratio will be within the sweet spot. When the athlete is training within the sweet spot, we are sure that the injury is at its minimum. The big problem now that we can discuss that for table tennis, the sweet spot, it is not yet discovered, as the major works, they were done on other players, either football, team sports, or rugby sports, etc. Now, our role also in the prevention is also very important. Put a plan for recovery and wellness. So our strategy usually is using water-based recovery means, either a hydro pool, a swimming pool, or jacuzzi, sauna, etc. Doing stretching sessions and massage, meditation, it's encouraged also. It is very important for some adolescent athletes or even people with overused injury to use cross training. We encourage them to use cross training, for example. Aqua jogging is a very, very good alternative, and limited advised or recommended some limited periods of passive rest, but they should not exceed some days. You cannot prevent what we don't know. So we have to do also, we are active members in research and development in physiotherapy. And I show you here this graph from a Van Mechelen model, the model which was conceived in 1992. First of all, we have to see the extent of the problem. That means what is the main problem, what are the main injuries that are occurring in a team of table tennis athletes. Then we have to see what are the probable causes of this injury. Then we have to implement or think about a prevention plan, make it into application, then go back again to square one, try to assess this plan, and this is what we should do. Of course, some initiatives were done. We have done, for example, at Aspire Academy, we have seen the rate of injuries, and we found that the majority of injuries, they are overused injury. Then we found that there is a relation with growth and maturation in adolescent athletes, and we conducted some pilot study in table tennis to see what is the acute and chronic workload in adolescent athletes. Now, what are the topics that we can research in table tennis? If we talk about the adolescent athlete, we have the acute chronic work ratio specific to table tennis, because if you go and see what are the injuries in other sports, you find it will be different, and we have some numbers. Then you have to see load monitoring wearables. What is the appropriate wearable that should be used to monitor the load in table tennis? Is it Polar? Is it some other or GPS or something like that? Of course, we have to discuss this, and we have to conduct studies about injury epidemiology. For the adults, we can do the same. We can think about multi-center study for ITTF injury epidemiology. Now, our role is very interesting and very big, and we have a unique experience at Aspire Academy dealing with the adolescent athlete. Now, if we go to the WHO, what is the definition of children and adolescents? Generally, they are up to 13 years old when we are talking about children, and we are talking about adolescents from the age of 14 till 18 years old. What is the crux of the problem for the adolescent? If you see these small clips here, you see here we have the knee, and you can see the excursion of the tendon between the patella and the anterior tibial tuberosity. This one, because the physis is not yet fully mature, though there will be a pulling on the bone, and there will be inflammation at that site. This can happen at different muscle attachment in different anatomical site, and this is very important and leads to a lot of day loss from training, and it leads also to a lot of burden for the athletes and the coach for planning their short-term and long-term training session for the adolescent athlete. So here I will give you an overview of the growth and maturation and their role to this. You know that peak height velocity is the salient feature of growth and maturation, very important. And you have to know also that there is a large maturity variability between two players. If you see the X-ray at the left side, this is for two athletes within 1 week of birthdays, but you can see that the maturity of one is different from the other for 6 years. 6 years is too much. That means you have an athlete in 11 years old and the other one is 17 years old. And still you are training the same boys with the same coach and with the same plan sometimes. We have to think about it. because the load will be different, the perception of the training will be different between the two, and the psychology of the two guys, it is totally different. And you see also that the early mature, even in table tennis, they are more favored, they are more selected into the teams rather than the late matures. So here, very careful attention to the people who are selecting the athletes from the grassroots to put them into the academy. That means sometimes you are missing the best players just because they are late mature, they didn't get their advantage to be at that academy or that club. So we have to think our selection, our bias towards the early mature is not always the best. So from where the growth-related injuries come? Because there is a lot of mass campaign to push the adolescent athletes, to push the public for sports participation. So the byproduct of this massive sports participation is the overuse injuries. And in the case of the adolescent, they are very specific. There is physis, and the physis is immature skeleton. There the problem can happen. And as I told you, we have conducted studies and we found that 1 child on 2, they have overuse injuries. And 1/5 in injury, they have growth-related injuries. And most of those injuries, they occur during the growth spurt of what we call peak height velocity. If you see here in this slide that these injuries, they are aligned with the predicted mature height in this cohort we have studied. And these injuries also, they are according to the percentage of adult height in elite soccer academy, but also in every sports, including table tennis. So if we are talking about growth-related injuries, and we are talking about peak height velocity, there is what we call circa PHV, that means the period between where they occur the peak height velocity, and we have pre-PHV and we have post-PHV. Then in the circa PHV, the injury risk is increased by 115%. The burden, that means if we associate the day loss from training, is increased by 225%. And the majority of injuries, the growth-related injuries, they are 42%. That means this period we have to be very, very critical for the injury occurrence. You may miss your best athlete during this period just because you didn't pay attention to his growth and maturation. Here a map showing what are the array of these growth-related conditions. Different sites. We have specific injuries to the knee, specific injury to the ankle and foot, specific injury to pelvis, spine, shoulder, and elbow. So we have to pay attention to these injuries, and we have even more attention that need referral to specialists, mainly the orthopedic surgeons, to take care more because they affect the strength of the boy, and they may lead to leg discrepancies or something like that. And we have the chance to work a lot on these growth-related conditions, and we have tailored some protocols, for example, for Osgood-Schlatter disease, the famous Osgood-Schlatter disease, the injury that apophysites that occur in the knee for adolescent athletes, and we give them color code, and we have stages, the acute stage where we cannot allow the player to train, and our aim, of course, that to progress toward training, but when it is needed and required and indicated also by the recommendation of the IOC that you should not train a boy within pain. So usually our aim is the availability of the athlete. So we progress from acute stage to the mid stage and to the late stage green, where the athlete is fully discharged but monitored at the same time when they are in the period of growth and maturation. This is a sample of the protocols we are using. Now, our role is also to support table tennis during tour and competitions. And first of all, we are using the emergency toolbox. Of course, this is caution here. It should be in accordance with the local regulations, because in some countries, if you travel with medication, it is prohibited or it is with prescription or something, while it is authorized in some other countries. Some countries, for example, they don't allow the medication with antibiotics using without prescription. Some other countries, they allow this. So this is very important to take into consideration. We have also tailored the travel toolbox for the table tennis athlete. And here I can give you some examples you are familiar with. First of all, the stretching equipment. And we have to teach the athlete that they should use them at any time. The TheraBand, many colors, also to make some strengthening, some maintenance program for the training of the athlete is very also important. Self-massage, sometimes we have to loosen some part, tighten part, and we have to use self-massage, reflexology, and therapy balls. Very important. The balance and perturbation tools, of course, we can take the Airex instead of Bosu, and also this is very important as a prevention way for the ankle sprain and like agility. Inflatable balls is very good also for core stability and working myriad of exercises. Now, what will be my take-home message? Physiotherapy scope of practice is far broader than injury management, but also it is a pivotal role as a member of multidisciplinary team. We are not working alone. We are working surrounding the team of table tennis with another team of sports scientists. And table tennis can operate optimally within the sphere of sports medicine, sports science, and within a service team. We have this example in Aspire Academy, where we have a coordinator of service team, and he's coordinating all the sports science, sports medicine specialist people around in consultation with the coach and dealing player by player and what will be the plan, short-term, mid-term, and long-term plan. And the staff is working with adolescent players should be very cognizant about growth and maturity, because you can make your adolescent athlete enjoying his passage during his growth and maturity without a lot of burden and with minimal injuries, with minimal absence, and with maximal availability to his coach. With that, I can thank you very much for this very valuable time to present to you. Thank you.
Thank you very much, Abdallah, for your presentation. And yeah, I see you are now stop sharing your screen. Great, and we can see you now bigger on the screen. And we received a few prior webinar questions, but before going over to them, I would like to invite our attendees to ask any questions related to the topic of today in our chat. And yeah, please, Abdallah, can you stop sharing? I think it's still on. Yeah, perfect. Yes. Perfect. And I will start now with you with the first prior webinar question. Abdallah, Abhishek Shah would like to know or ask this question. Many beginners tend to get back pain, shoulder pain due to the body stiffness while playing. And he says, any suggestions apart from following relaxed body? I mean, it's also about, in my opinion, strengthening and flexibility. But what do you think? Which suggestions do you have?
Talking about low back pain,
shoulder pain, to the stiffness while playing, you know.
Very good. So talking about low back pain, from my experience, you have to make sure that your athlete is very flexible and mainly the lower limbs, because if you have a stiffness of your hamstrings, If you have not activated the glutes, then all the burden will go to the low back pain. So that's why you have to take care. First of all, you have to do a very thorough examination of your athlete. Make sure that his hamstrings are not stiff. Make sure that he had a very good activation of his glutes. Then all the burden will not go to the back. We have seen that sometimes with an intervention, doing a thorough flexibility for the hamstrings, 90 degrees, then the back pain will be reduced, and within some days he will be back to his training without any complaint. This is talking about back pain. If we talk about shoulder, please here, when you have a pain in the shoulder, you have to make sure, first of all, you have to get rid or to pay attention to the red flags. Sometimes a pain of the shoulder, it is what we call exertional pain. That means it is coming from the cardiac problem, or it is coming from a referred pain from something else. You have to make sure that the pain is coming from musculoskeletal problem, and it is not coming from a systemic problem, cardiac or something else. When you are sure your pain is coming from musculoskeletal problem, then it is very easy. You have to work on what we call harmonization of scapula, and this scapula and shoulder, dyskinesia, as I told in my presentation. You have to harmonize your scapula and shoulder joint. Then you have to do some stretching of the pectoralis muscle. Then we have to make sure what is the diagnosis. If it is an impingement, that means you have to give him change the way he's playing, but not the technique. This is up to the coach, but we can advise the coach to, for example, to give him a period, instead of playing too many balls, he have to change it, something else, for that period to alleviate this kind of problem.
Thank you, Abdallah. Abhishek, I hope your question, the answer of Abdallah helps you. And I would like to pass now the word to Massimo.
Thank you, Dominic. Thank you, Dr. Abdallah. Extremely interesting, all the facts and the things you have presented, and I'm sure all our attendees are enjoying this webinar of today. Yes, Dominic said we have received some prior webinar questions. I have one from Luis Gerardo Padron Cabrera, and the question is the following. Between the hind foot and the forefoot, which one is subjected to the greatest biomechanical demand in table tennis?
This is a very tricky question, and talking about the biomechanics of the foot, which is under the scope of podiatrists. But for table tennis, in my opinion, the forefoot is more used because it is tendency, because it is for balance, it is for landing, etc. So a little bit it is for forefoot. That's why we will find in some table tennis athletes some callus formation and dry skin in the fifth toe or in the first toe. So in my opinion, the burden is more on the forefoot. Of course, normally the weight should be balanced. This is the best case scenario, that the weight should be balanced in all the foot, but I think usually they are more in the forefoot, and we should encourage these players at least to do a proper landing so that they will not twist their ankle, because when you are on the forefoot, you are more unstable and there is more risk that you twist your ankle. But of course, they are used, and part of their training normally it is proprioceptive work and balance exercise and perturbation exercise, enhance their proprioception and their balance.
Perfect. Great answer. I believe Luis Gerardo will be happy of this answer from Dr. Abdallah. And I would return the questions to Dominic. Dominic, back to you.
Thank you. And I would say, Massimo, that we keep our questions for the very end. And now the questions in our in-webinar chat are coming in. And I have one question, Abdallah, from Aaron Abella. Did you ever have any players that encountered nerve problems in their hands and feet? Examples of such issues are carpal tunnel syndrome or neuropathy. If so, how was this resolved?
Carpal tunnel syndrome, no. But I have witnessed with some coaches, they are players also, with some coaches, they have nerve entrapment in the elbow. And it was a little bit so severe, they were referred to surgeon, and the surgeon, they have done debridement and they improve the course of the nerve. But it happens, but I didn't see carpal tunnel syndrome, no. Honestly, I didn't see this, no. But for nerve entrapment at the level of the elbow, yes, there is.
Okay. And how did you resolve all the things?
Yeah, for the elbow, there is what we call like a gliding treatment. There is, if you see, this is the typical treatment of nerve entrapment is gliding movement that allow the nerve to have its path good, and we have to do a lot of mobilization so that there will not be adherences around the nerve and then make it gliding freely in his sheath. So this is the main aim of the treatment. Of course, we have to control the inflammation. We have to control the swelling, post-surgical swelling. This is if he will go to surgery. If he will not go to surgery, we can treat this with either medication. We can treat this with some stretching, because sometimes it is coming from a tight muscle around the elbow, and these tight muscles, they can compress a little bit more the nerve, make it a little bit inflamed. So we do this, but we are not sure that our interventions will succeed. That's why we refer them for some period of time. If we fail, we refer them to the surgeon, and the surgeon usually, they electively do some surgery to liberate this entrapped nerve and make it a little bit more free.
Thank you very much, Abdallah. And I would like to take now one of our questions, Abdallah. And
yes.
You mentioned the ankle sprain, and I would like to know how much time after it happened, you know, the athlete has to treat it, and if the price, the protection, rest, ice, compression, elevation method is enough, or if anything else can be done additionally in this case.
Thank you, Dominic, for this good question. Ankle sprain is a challenging thing. What happens during ankle sprain, if you don't have a good stability, if you don't control your landing, if you land in a very awkward position, then what you do, you sprain your ankle, and mainly it happens in what we call medial ankle sprain. That means the outer side of the ankle. Of course, the problem, we have what we call some grading of the ankle sprain. There is grade 1, grade 2, and grade 3. And actually, there is overdiagnosing of something we call the high ankle sprain, HAS, the high ankle sprain. This is the most fearful type of ankle sprain. That means it comes a little bit high. It is between the joint, the fibula, the lower fibula, and the tibia. And there is what we call some diastasis between the joint. When there is some diastasis, then it is really very severe. And then sometimes there is an indication for surgery to make it stable. If this is not the case, then we have to examine our ankle if there is what we call Ottawa rules. Ottawa rules, they are the rules that govern the injuries to the ankle. We have to make sure that there is no fracture associated with the ligament injury. If there is no fracture, then we are a little bit safer problem. That means we have only ligament tear. When we have ligament tear, is it grade 1 or grade 2 or grade 3? If it's grade 1, then let's say it is 10 days, a week. But of course, with treatment, with treatment between supervised by a physiotherapist, we should see it. We should follow this. We should allow the player to walk on an even surface. We should not allow him to go for uneven surface, for example. We control him for 1 week, and then normally it's okay. And we advise him to do a lot of balance exercise to make it not recurrent, and to perturbation exercise to make him a little bit like the ankle is a little bit awake. If it is grade 2, then it is a little bit challenging. Then it can go to 2 weeks, minimum 2 weeks, and then our intervention is a little bit more important. We have to start our functional work. We can do for him some light immobilization, not a strong one, like bipolar, like ankle support. And then at the same time, we have to teach him how to do a lot of pumping. We can use some anti-inflammatory procedures and modalities. And then normally after 2 weeks, he can rejoin progressively his training with a lot of exercises. We discuss with our SNC coach, involve in his session a lot of perturbation exercise and proprioceptive work. If it is grade 3, then it is a little bit challenging, and it can go up to 6 weeks. And there also we have to follow that from the acute, then intermediate, then the late phase of rehabilitation. Of course, at the same time, we can use other alternatives of treatment like swimming pool, like hydro jogging in the water, etc. This to fasten a little bit our rest time. And at the same time, we have to involve the nutritionist so that he will not gain a lot of weight. We involve the SNC coach so that he will do for him some core stability, etc., so that everything will go together. We will not only concentrate on the injury, but at the same time take it as a whole, so that our player will not miss a lot of things at the same time.
Thank you.
Yes.
And also fingers crossed that this will never happen to the athletes, you know.
Yeah.
And yes, I would like to pass now the word to Massimo.
Yeah, actually, thank you, Dominic. Actually, I have a question. Well, we understand how important today, even more, how important it is to have a physio in your staff. I mean, from the coaching point of view, and so in order to work to optimize, to avoid injuries and so on, that can be connected with also with the coach, with techniques related to specific table tennis. My question is related to something that it can happen every day when you train. We call maybe micro injury, which can lead also to something serious. And then when happen, it's because was bad habit or wrong attitude in action, or maybe in something else in fitness, exercise, and so on. So what are the signs? What as a coach point of view, what we should focus on the daily practice in order to to catch, to understand better and not reach that moment that the injury occurred. I don't know if I made myself clear.
Very, very, very good question, Mr. Massimo. Very good question. You are touching a very important topic in sports medicine, what we call the overuse injury. The overuse injury. That means you gave it a very good name, micro injury. These are the injuries that are silent, and with time they accumulate, and they give a big one. This is very important, and this is the very important role of the physiotherapist, to be with the team or very near to the team. Why? Because I have to notice these small things and to have to record them if they are recurring day by day. Then, for example, today he told me I have small pain here or small pain in my knee, but he will not stop. The second day he will repeat the same thing, the third day or next week. Then I have to think that there is something wrong with this guy. Probably he has a deviation if he is biomechanical. Probably he has very poor landing technique. Probably he has a flat-footed, or probably he has very high arch of his feet. Or at the same time, but I hope that coaches will not angry about me. Sometimes it is technical error. Sometimes the coach, for example, the technique of the boy is wrong. So we have to sit with the boy, see exactly what is this overuse injury. Then we have to flag it out to the coach. Sitting with the coach, telling him, coach, please, this guy is recurrently complaining about his right knee, and I see that the pain is more and more and more. Is it possible? For me, I think that he has flat feet. He has very deviation, biomechanical alteration of his lower body. I will send him to podiatry. But at the same time, can you help me with his technique? Is he having the good technique? Then the coach, for example, will pay more attention to this guy, how he is moving, how is his footwork, is he doing the right things or not? Probably the coach then he will pay more attention because, for example, from my experience, I am dealing daily with the coach, and the coach tell me sometimes very, very good hints and help me to diagnose it and to trigger the problem very easy. So we are talking about an important topic in table tennis, which is the overuse injury, and we are doing a lot of effort to capture them. And it is a real topic in the sports medicine, how to categorize the overuse injury and the acute injury, because the acute injury, they are clear, as Dominic asked me. We can know the ankle sprain, but it is very difficult to know another problem coming from overuse injury. So thank you for that question.
No, thank you. We thank you for your answer because yes, you confirm that the cooperation between the physio, the coach, the observation, the monitoring, to catch all the signals from the players, comments, feedback is everything important to detect. Let's say like that.
Exactly.
To make the early intervention and avoid to reach that bad moment where something is really serious. So thank you. We thank you actually.
Thank you.
So again, I pass back to the next room to mine. So Dominic, back to you.
Thank you very much, Massimo. I think the only difference is, our background, the picture. Abdallah,
yes.
Benoit Silbert has a question, and he says, hello, what is the epidemiology for the groin pain and the FAI in tennis de table?
Epidemiology of groin pain.
Yes.
This is the FI. The epidemiology of the groin pain, honestly, I don't have the number with me now, although I have done a study for all sports in Aspire Academy. If you like, I can give you the paper. I will send it to you, the paper. It is written, and I have almost details of all epidemiology of all the organs in all the sports, probably in table tennis also. I have this, but I don't have now the number in my head about the groin pain. But talking about the FAI, which is functional ankle impingement, yes, we have the ankle impingement. It could happen, but sometimes when there is an ankle sprain which is not good rehabilitated, then probably we will have like a sequelae of ankle sprain that could mimic or could exhibit itself in an ankle impingement. It can happen, or sometimes it is anatomical variant of the athlete. There is like the calcaneus is a different anatomical variation that could lead to some impingement, but it is not really widespread, or the epidemiology is not very high, but it is, we can see it. It is there.
Thank you, Abdallah and Benoit. I hope the answer from Abdallah helps you. And I have now a question from my side. Actually, there are two combining questions. Abdallah, when should prevention measures or physiotherapy exercises be introduced like the stabilization or any other stuff like this? When is the appropriate age, you know, to do so?
Good. So, talking broadly about prevention. Yes, what we are doing, what the habit we have, what we call at the start of the season, we are meeting all the athletes. For example, I will be talking about adolescent athletes. We meet all the athletes, we invite them, we have a battery of testing, or we have a template. And in that template, we are going like scientifically. We see what are the problems that occur in a table tennis player or any other sports. For example, as I told you, we have to take the record of previous injury. Then we have to see what we call musculoskeletal screening. We go from the head to the feet, and we start to see where is the abnormality. But as I told you, the abnormalities themselves, for example, the guy could have a biomechanical deformity, but because it is not symptomatic, that means he is not complaining, and sometimes he's a very, very good player, that doesn't mean it is a problem. But we have to write it down and then waiting the appropriate time. If there is any symptoms, then we try to intervene, for example, using podiatry, using, for example, some pelvic stabilization, using some muscle strengthening, using some balance of muscle or something like that. But when it is symptomatic, I cannot advise a coach who have a very good athlete, talented athlete, for example, just because his knee, they're in various position, and telling him that this guy should go for a prevention plan. No, he's not symptomatic. So we have to keep him. We have to just probably raising this to the coach, watching him. If there's any symptoms, then we have to start. Another thing, we have the hotspots. If, for example, I screen a boy and I find that, for example, he is symptomatic, he has some low back pain and he has some, or he's crossing the growth and maturation side, then I have to flag out this athlete to the coach, telling him, can I please follow this guy once a week before training session to see how he is coping now in this period? Does he have some pain or not? This have shown, there is some study that shown that it will reduce a lot the number of days absence and the injuries for the athlete. So we can be a little bit proactive, as we can see also retroactive, that means reacting to what the coach said, and we can do a plan of prevention. But at the same time, with our screening and profiling the athlete, then we can be a lot ahead of the problem and solving the problem before it happens.
Thank you very much, Abdallah. But I have now the combined question to this one. And you mentioned the musculoskeletal screening, yes? And
yes,
my question is, how often, I mean, in which frequency should it be done?
Yes. So what we are doing, for example, let's say we're starting after a period of detraining. For example, we start in September. So, for example, the first 2 weeks in September, we do our screening. Then we repeat this after 3 months, then after 3 months. And this is normally we are doing this. But the problem, this is in the best case scenario and the ideal scenario we are doing. But to be very honest with you, we have some challenges sometimes with the coaches. Sometimes the coach, they don't give us the boys to screen them because they have either tight calendar or the boys they are on tour or competitions. So we are always trying to find the fitting time when we can do these kind of things. And we have many times we approach, for example, our service team coordinator, and to find the appropriate time when we can do our prevention plan, either stretching for one guy who is stiff or referring one guy who has high arch or flatted foot to a podiatrist. And then we have to find the suitable time with the coach, because the coach, they are at the end, they have their plan and programs. They are very well cooperating, but at the same time, they have their own agenda. And sometimes it is not in synchrony with what the supporting team is doing.
Thank you very much, Abdallah. And I pass the word to Massimo.
Yeah, one more from Aaron Abella. How important is static stretching in table tennis? When should this be done more often? Would you rate stretching more important than physical training? Oh, it's 3 questions he made actually.
Yeah.
How important is the static stretching in table tennis? When should this be done more often? And would you rate stretching more important than physical training?
Of course, we know in the world of table tennis, normally the table tennis athletes, they have their proper routine. That means before and after finishing the session, they are doing their stretching. But this is, for me, from my personal experience, this is really very low impact on the real stretching of the muscles. Why? Because the guy, after finishing their game, they're joking, playing, socializing, and they are seemingly doing some stretching. They are not really doing impactful stretching to their bodies. So what's happening? That they are giving themselves a fake stretching. That's why the role of physiotherapist during the screening, or occasionally when we are dealing with the coaches, to detect the boys who are really stiff, and we do for them the personalized stretching as specific stretching, and usually it is static, and we so that we reach our target, that the muscles are really elongated in a proper way and in synchrony with all the body.
Good. So then maybe the other, would this be done? Okay, you have replied perfectly. I have one more actually regarding, okay, not for the performance, making the tests. What kind of tests can be done, as one more time, you know, in a group of players, there is only the coach, just to help the coach how to understand better and how to prevent. Actually, there are any kind of test that can indicate something to the coach, that, hey, look, this one is maybe the back is too stiff, or the back is not having properly. So what kind of test can be done in order to avoid the injuries?
Good. So I can give you one test. For example, you are sitting and the guy is standing in front of you, and just to ask him to stand on one leg, single leg stand, and see, for example, the time he can stand balanced. And at the same time, you are from behind and seeing if there is any disbalance in his pelvis. Because sometimes there is disequilibrium like this. That means you have non-balanced pelvis and non-mobile pelvis. This guy, he will need mobility. He will need mobility for sure, and he will need some kind of strengthening and balance between the muscle. This is very important. So we have to think about. This is a simple test.
Simple, but
very efficient. Yes. And for example, standing, for example, calf raise. You have to tell him calf raise, for example, to see single leg, to see, for example, what is the tonus, what is the balance of what is the strength of the posterior shin. And another test, very easy, is supine on the bench, and you ask him to flex his hip and his knee 90-90 in this position, 90-90, and then asking him to extend his knee. If he cannot extend it, that means he has a very, very stiff hamstrings. And then easy, you can detect it, and you can say this guy, he's stiff and he should do some. He may be prone to the low back pain, because I told you, when there is stiff hamstrings, you may have low back pain.
Yeah.
Very important, yes.
Yeah.
So there is 3 or 4 tests that you can depict, and easy.
Then can be easily conducted and give some idea right away.
Yes.
So great.
Exactly.
Great. Thank you, Doctor. Back to Dominic.
Thank you very much, Massimo. And Abdallah, I have now a very last question. for you for today. It's a little bit sensitive. You mentioned the creaking of the joints when you are blocked, when the athlete is blocked, right? So
Yes.
what is your personal opinion? Of course, if the creaking is allowed in the country the athlete is from, because I know some countries, in some countries it is not allowed. What would you suggest to do this method, or what is your personal opinion about this method?
Okay, now also, as you said, you are talking about some tricky things. For this joint mobilization or something, there is what we call the osteopath, and there is what we call the chiropractor, and there is the physiotherapist. The physiotherapist normally, it is not in their scope of practice to do these manipulations. But of course, some people, for example, myself, I have certification in osteopathy. And some people, they have done what we call DO, Doctor of Osteopathy, or they are chiropractor. They're allowed to do some manipulation. Manipulation, they are not so easy. They are not so authorized. And probably you can do them, but if there is a problem that happen, you will be very accountable. Because if you don't know them, you are not really allowed to do anything you don't know. Your scope is limited by your knowledge. You don't know how really to manipulate your cervical spine, and you try to do something like that, and then that problem happen, then you will be really accountable. My advice to my colleagues and my advice to myself first, if you don't know how to do a technique, better refer your athlete to the appropriate person, either a chiropractor or a real skilled osteopath who can do for you this. Or find an alternative from your therapeutic arsenal and do it by yourself in a safer way. Our end aim should be safer players. We are there to help them by any way, and helping them by doing the right things at the right time.
Perfect. Abdallah, thank you very much for this, for your honest answer, I have to say. Yes, and the time is flying, Abdallah. And dear Abdallah, we, the entire ITTF HPD team, we thank you a lot for taking the time to be here today and sharing your vast knowledge and your expertise regarding the physiotherapy support in table tennis. So thank you very much, Abdallah.
I should thank you also for this very great opportunity, and to you guys all, thank you very much, and thanking you again.
Thank you very much. And thanks also to our audience out there for attending. And we hope our 49 ITTF HPD Table Tennis at Your Fingertips webinar was very interesting and, of course, also educational for you. And I'm looking forward to our future webinars for which further information will follow soon. So stay tuned, do your exercises, as Abdallah said, and strengthen your body. And that's all from my side for today. Stay safe and healthy, and I pass the word to the room next door to my dear colleague Massimo and ask him kindly for his closing words before we are going back to the venue in Slovenia for watching the under 15 and under 19 girls semifinals of the WTA Youth Star Contender, which can also be seen on YouTube via the live stream. So although you are not here, you can follow them. So thanks, yes. And pass the word to Massimo.
Yeah. Thank you very much, Dominic. Yeah, you have announced everything, so I'm not going further. Yes, again, want to thank Dr. Abdallah Recep for the brilliant explanation, presentation, and answering all the questions perfectly, I would say. So we thank you very much. 49 webinars we have done so far, so we are looking for making something for the 50th webinar. So stay tuned with the ITTF webinars, and hope all of you to have a great day ahead, and we go back to the venue for the semifinal. Thank you very much all, and ciao.
Thank you. Bye-bye. Thank you.
Bye-bye.
Thank you.